this message that we need to correct when you're going to do care reform. And this is where we had our senior challenges of some resistances from the institutional care, especially the private one, because the message was going all over that the government is cracking down and closing down institutions. Can I correct that from where I stand and where my seniors are? We have our CEO, we have the director, we have a secretary here. And I say these words, that the government is not closing down institution, we are transitioning. And there's a very big difference between closing down and transitioning. And then we are transiting children and system infrastructures. We will be doing the deployment of the staff. So those who are saying the staff are going to lose their jobs, actually the system is requiring that we employ more social workers and more people. It is not saying, in fact, people are saying this, if somebody is saying we are going to lose more jobs, I can tell, they do not understand care reform. Because care reform is actually going to bring more jobs for those institutions.
Before, the process of integration was not that easy to most of us, but now we are not experiencing a lot of problems when doing the reintegration process. Nevertheless, we have encountered some challenges, and when I was requested to give a presentation during today's event, I had a conversation with a few of the CCI managers to find out on the challenges so far encountered pertaining to care reforms. And some of the challenges cited were, one of them is human resource limitations, where we have inadequate staff to meet the demands of care reforms, because care reforms is quite demanding in terms of human resource. Number two, family and community readiness. There has been reluctance of families and the communities to receive children back. Then financial constraints, whereby you find that there is limited funding to support the transition process. Also, families' expectations. Families often expect CCIs to cover all basic needs for children under their care. Then there is limited information from authorities, whereby you find that the police, the chiefs, and the assistant chiefs often place children in CCIs with little or no background information.
Government, we are committed to what you intend to do, and especially implementing the reforms. And that's why we have a department that deals with matter children. That's the Department of Sports, Culture, and Social Services. And we have the chief officer here, and also the director. And we also have a sister department, Gender and Youth Affairs, mostly dealing with the GBV. You know, of course, when there's GBV, children are also affected, and they might find their way in those institutions.
We all know that children live, thrive, and grow well best in their home, and the family and the community are the natural units that children are brought up. We appreciate the good work that institutions may be doing. However, from research at national and at global levels, at regional levels, it has been established that institutionalization has more far-reaching negative effects on children than the positive effects that it may have.